This panel discussion will select startups, decode the whys of the startups and how they have handled structural challenges and create new opportunities and the multiplier impact they are creating for the country. I'd like to request all of you to please welcome our speakers onto the stage. Geethanjali Radhakrishnan, founder and managing director, Adiuvo Diagnostics. Abhijit Chaudhary, founder and CEO, Niral Networks. Nikunj Parashar, co-founder and CEO, Sagar Defence Engineering. Prem Kumar, founder and chief innovator, Marut Drones, and moderating the session is Manjot Pahwa, Vice President, Lightspeed. Please welcome them on stage for this next panel discussion on deep tech startups, scaling and impacting India.
Hello. Amazing. I am very happy that today we're sitting here with an amazing panel such as this to discuss deep tech startups in India. I think there was a time when, for example, when I was a founder and I was building something within machine learning infrastructure, and even that was considered deep tech and rare to find. So it genuinely makes me very happy that we have examples like Marut, like Niral, and several other examples that we don't even know about being built from India today. So I'll take a moment and introduce my amazing panel, starting with Prem, one of the youngest innovators in drone technology and building Marut. He won the Forbes Asia Under 30 award. Marut is basically trying to solve the problem of malaria and dengue, and amazes me that enterprises like these are trying to have the vision that they have. So would love to play a video at this point on Marut to give you a better sense. So yes, drones can be used for a whole lot more than delivering your Amazon packages. And I'm so happy to see these use cases being developed out of here versus other parts of the world. But continuing on our amazing panel, we have Abhijit, who's the founder and CEO of Niral Networks, which is basically building a private 5G and edge platform for managing enterprise connectivity problems, a problem that is also close to me, having come from a networking background myself. He was also previously the co-founder of Entrance Networks, and similarly building more network virtualizations and 4G technologies out of here. He was also super happy, again, to welcome an ex-Googler. He was part of the Apigee acquisition, which is a part of Google now. We're going to play yet another video on Niral Networks to learn more about what they're building.
Industries running the economy like oil and gas, mining, ports, power grids, and many other require vast areas to function. Safety, connectivity, and productivity in every aspect is crucial to meet the increased demands of current time. Industries are embracing digitization, but still the process seems to be slow. Modern industry requirements such as multiplayer gaming, logistics, mining face huge issues in scaling due to limitation of current communication architecture. For example, consider the use case of this refinery where there are multiple IoT devices and applications which require high throughput and connectivity are being catered through traditional Wi-Fi based stations, access points and their edge application sitting far away from the premises, resulting to lower throughput and higher latency. Digital transformation has always been a challenge for these sectors, but not anymore. To solve this problem, Niral Networks proposes the use of private 5G over Wi-Fi, where the RAN device, 5G core, and the edge application server is situated inside the premises, eliminating all the clutters and providing a very high throughput and ultra-reliable low-latency communication, suiting the modern requirements for covering a wider area, using less number of radio units and leaving behind no dead zones in the area of deployment. Introducing Niral OS, where Niral 5G core, Niral Edge application server, and Niral controller comes under a single operating system, easy to install and deploy on the go and supporting all the major CPU architecture available in the market.
No offense to the rest of the panelists, but we're saving the best for the last. So now, lastly, we have Geethanjali, founder of Adiuvo Diagnostics. She's born and raised in beautiful coffee plantation, Munnar, and is an engineer as well as an MBA by training. Hailing from a place which, access to healthcare was like 100 kilometers away from her, she felt that her background could be better utilized to solve exactly that problem, which is developing better healthcare in low-resource settings. And that's exactly why she's building Adiuvo that basically helps with, focuses on optics, electronics-based solutions, along with AI technologies towards disease diagnosis in these low-resource settings. So yes, can we have the video? There's no audio.
maybe I can just give a thing. So basically, we have developed the next generation X-ray where you can detect the bioburden on the wounds. So the audio is missing. So it's a very global issue that we are trying to solve. And we have brought down the cost, which traditionally it would take for an optical solution, it would cost anywhere between 2 CR to 5 CR. And we have brought it down 1/10 of what is out there. And it's made in India. And it can detect bacteria at the point of care just instantly. So it brings down the rate of amputation and prescription of unnecessary antibiotics. Yeah.
I know you're tired of hearing my voice, so now I think we'll start with just hearing from more from the speakers. So maybe we'll start with Geethanjali. I mean, India is obviously known for some of its biomedical outcomes, but it is so hard to, in general, build one, and it is even harder to build a social techno enterprise such as what you're building. And of course, you're building one of the best multispectral bioimaging products and companies with these multiple product lines and multiple issues that we're solving. Would just like to hear your story on how you got started, because I mean, it feels so intimidating to even get started in this, and especially being born and raised where you were. Maybe just your story. Would love to hear that.
Sure. So basically, after my bioengineer, I was a software developer, and then I decided, okay, I had to do something back in my bioengineering. So little did I know the hardships of starting a company. Now, what really fascinated me was I just started, and I had a support of a social incubator called as Wilgrow Innovation, and through the program, I had a chance to visit a doctor in Pune who treats 200 wounds daily. And what was surprising is nobody knows about the problem of wounds. It's even more deadly than cancer. People don't, it's a poor man's disease. Anybody who has diabetes has a risk of developing a wound. And then that's how I got to know about this problem. And what was very important is many times when they go to a doctor, they get prescribed unnecessarily on the counter antibiotics. Sometimes you just go and ask, I have a throat pain, give me something, and they give you something to treat the streptococcus bacteria. And that's the main issue, where 2 lakh amputations are happening on an average in India, and 600 million wound cases all over. So, and the person who had visited the doctor came at an advanced level of amputation. And the problem was very simple. It was a fungal infection. The doctor gave an antibiotic for 3 years. So that's really what motivated me into getting into this problem statement. And it has to be instant, it has to be non-invasive, and we want to develop something that's similar to an X-ray, similar to the CT angiography that you do, where it's a light-based solution at the point of care, and which can detect instantly so that you don't need trained manpower. So that's essentially how I started, and little did I know what all I had to go through to commercialize this technology in India and also take it abroad. Yeah.
Awesome. Maybe we can move to uncovering more about what all 5G enables. I mean, we all know 5G is one of the rages today, and every single networking innovation becomes way more than what networking is in itself. It basically unlocks the next phase of development of the whole country in waves, if you think about it. So yeah, Abhijit, would love to hear from you. I mean, obviously, super regulated space and something that can enable lots of things. Maybe talk through what all things it can enable and how the journey for India has been in terms of unlocking some of these networking innovations.
Yeah, thanks, Manjot. I think the journey, I mean, if you talk about 3G, 4G, 5G, it's a journey for every decade. Like every 10 years, you come up with a new G. And for me, 5G has been a revolution. Not that because I started Niral, but overall, I feel that. And in fact, that was also one of the motivation for starting Niral. Till the 4G, right, it was a very, very closed environment. Like, it was very, you can say that hardware-centric and closed by very couple of big OEMs. The entire demographics or the entire system was controlled through that. But when you come to 5G, right, one thing which has happened is that most of the intelligence is moving to software. Like the hardware, of course, is important because you need a radio. Like in Wi-Fi, you need an access point radio. Similarly, in 5G, you need a 5G radio. But all the next level of baseband processing, even the baseband processing of the radio signals are being pushed to the software now. And you don't need very proprietary hardware anymore. You can run it on the existing commodity servers that we are aware of. So that is I think, a very important disruption in this space. So which enables even the small companies to really start thinking that, okay, we can also work on 5G. From a technology thing, I think that was one key aspect. Now the second part, I think, a little bit to do with the regulation also. Predominantly, any of these Gs, right, needs a spectrum to start with. And the spectrum has always been very much controlled by the government, like in most of the places. In fact, in a lot of countries, still the operators, like the mobile operators, are generally government controlled or majorly government controlled. But with 5G, the idea is not only about providing connectivity across the nation, but it's also to enable connectivity within the hotel, for example, within a manufacturing plant, within a mining area. So there is a small thing which has come up, which is called private network, initially in LTE, but it's becoming really big with 5G. It's called private 5G. So it's about how you can create your own private network, similar to Wi-Fi, but with private 5G. And why we need private 5G here is that when you talk about Wi-Fi, right? I mean, traditionally for the last 10, even I think almost 15, 20 years, we have been using Wi-Fi. Wi-Fi has been great for like most of the applications we run, but this application that it is great for are predominantly like the consumer-facing application, like your like the apps that you run, or probably doing the Zoom call for your office work. It is great. These are IT-sensitive applications. It's not mission-critical applications, and you need not cover a very big area through that. Now, when you come to a mining, right, or a port, these are like 10 square kilometer to 100 square kilometer of area. If you had to put a Wi-Fi network there, then every 100 meters, you have to put a Wi-Fi access point, because the coverage of Wi-Fi is 100 meters. So that will not scale. Like, you have to put thousands of Wi-Fi access points and then connect it to a core or a single point to connect all of them. So first of all, it's not scalable that way, neither it is economically viable to build such solution. So that's why we need to use a system which needs less hardware components, but has a much wider coverage, vast coverage. That's where the Gs come into picture, or the cellular networks come into picture. If you see a 4G network, I mean, which is generally used for the non-public usage, each 4G towers can be 1 kilometer to around 2 to 3 kilometers distance, based on how much like obstacles are there in between. So like to cover a 10 square kilometer of a mining area, with a cellular network like 5G, you can cover with only like say 10 cell towers. So which makes it more scalable. And predominantly mining and most of the operation technologies, like we talked about drone, there are robotics, there are like IoT monitoring across the entire area. For an oil and gas plant, there are 1 million devices to be monitored, which is more indoor and outdoor. So you can think that you need a different kind of technology. That is what private 5G brings. Also, it brings security, which the normal 5G will not be. It is defined for enterprise, security and the privacy. So that is what we are trying to focus on.
Yeah, no, kudos to enabling and, as you mentioned, right, democratizing private 5G networks for the next phase of startups and enterprises. As I said, I think that truly unlocks like a lot of use cases that have not been even seen yet, and the next generation of startups. So I'm very excited about all of that. But more exciting are drones, especially coming from the Bay Area. Like, I've seen some of the cool things, both as from a personal point of view, but also from a business use case point of view, the things that drones can enable. So I'm very curious to hear more from you on what are some of the things that you expect, the use cases that you expect to crop up in India, given especially the rocky history that we've had with drones, and how you that are thinking about seeing a change in that.
Thank you. Is it audible to everyone? So how many engineers are in the room? Can you please raise your hands? Okay. So like everyone, I did my engineering. So graduated from IIT Guwahati, then worked like everyone sitting here. Then got bored, so started totally opposite a film production house. So then I've run a film production house for 10 years. Then like everybody stays remote to your parents, right? So I used to go every 3 months, 6 months, once to parents' house. And next to parents' house is a water body. From 2014 to 2017, I've been giving letters to, there's some malaria, some dengue, why can't you do something and everything. In 2017, that guy pulls up all the letters, says, boss, either you shift your parents or don't come to our municipality. Because neither we understand, we solve this. There's a 70 years, 75 years old problem, still nobody has solved. You think I can do some miracle? Then that's where we were trying to see. Like, how many of you see mosquitoes every day? Right? So we are purchasing BMWs, we are purchasing villas and everything. Still the problem is the same, right? But what we see is every year the majority of people pass away, not because of the accidents, not because of the dengue also. It's because of the malaria, dengue. There are new names to these diseases. Like you go to Kerala, there's Zika virus. You go to little Assam, there's Japanese encephalitis. There's many more such diseases which gonna hear in our lifetime. So what we saw is what they were doing it. They were getting into the water, clearing the algae plants, which you see, the water hyacinth, and they used to apply like a chemical kind of a thing to stop the breeding of a larvae. So for that 20 acres, they do some 10, 15 people get into the water till the neck level and they clean up and they do it. I thought there's just to apply itself, right? Then the problem was they have to treat every weekly because from a larvae to mosquito, which you see in the evening is adult form. So you have to reduce it, has to reduce it in the larvae stage itself. So then we started working and we said like, let's solve this problem. So I went to two of my batchmates, one was working in Qualcomm, one was in Samsung and everything. We said, let's solve this problem and everything. I went back to my own co-founders in the film production and said, I want to take a little break and want to solve this. So then we went up with a solution to the municipality and said, we want to solve 100% skeptical. I'm saying like, from ages nobody has did, you do something miracle, do you think? And there's a people and everything. So then we understood, if I do the same what others do, there's no change, right? So we mounted the sensors, what you see, these multispectral hyperspectral sensors and everything. We were trying to tell where is the menace and to reduce it, and also to tell them in that location where there's a dengue or malaria. So everybody, since there is a IoT giving data, nobody can say there's wrong or something, right? So this problem, so what we've seen in last 3 years is, in India, drones definitely going to see. But the problems of India are unique, which have been there from ages, years, and we are habituated to it. So like, let's have a mosquito bat or anything. For example, the second problem what you taken was in the farming. Like the farmer who is giving a food which is there's already pesticide intake, so that's why we are also going through a cancer. Everybody is prone to a cancer or carcinogenic in future. Is because the farmer doesn't know where exactly the pest or disease. So he uses the entire his farm. If it's 20 acres, he uses the entire 20 acres the chemical. Ultimately, the outcome which is coming is a pesticide residue. So what we are trying to do is, how do you do for human body? When it's a cough or fever and everything, we do diagnosis, right? And we do a specific kind of interventions. That's where what we're trying to do the farmer is to identify where exactly the problem and do it. With that, he is not going through a cancer, and where he was doing for 20 acres, he's doing only 1-2 acres now and with a lesser cost and a better kind of output. So similar like this, we have solved one after one. What we could able to prove in last 3 years is there's a technology, what we see every year. Everybody thought the technology is the internet or a mobile phone, which has helped humankind. Now there's a technology like a drone, which is increasing the efficiency, solving the real problem which we were thinking a person can only solve. And it's making it in lesser time. So that's what we could able to create and everything. So we were like very curious to solve it. That's the reason we built it. So we kept only one motto is, if you're building something, it should be tech-enabled, scalable, If I'm solving in one city like a Hyderabad or Bangalore, it should be solve a problem in Kerala thing, and it should also solve a problem in Africa kind of a country or any part of the country. So definitely we wanted to build specific solutions out of India to the world, and actually which has an impact and a scale. Thank you.
Thank you so much, Prem. I mean, I think all of us can agree that sometimes living with these infrastructure problems, we forget and we become blind to it. At least I have. So I completely agree that we're still sort of solving some of the core infra problems, which are super exciting. Now moving on to maybe slightly different question to all of you on the panel. All of you are operating in heavily regulated sort of industries, right? Whether it's 5G networks, ton of regulation and for the right reasons, whether it's the drone policy that has been changing quite rapidly. So, and also obviously medical diagnostics. I mean, it is always going to be a heavily regulated industry. So maybe, chat through some of the changes that you're seeing recently that can actually enable these technologies and enable innovation in these sectors in recent times. Starting with you, Prem.
So for a lot of reasons, COVID helped or not helped for any of the sector. It has definitely helped the drone sector is because when you're not want an interaction with a human, where people were using these drones for the surveillance, people are using for the disinfection, everything. Second, there's a locust attack happened to India, which is in the Gujarat or Rajasthan area, where they've tried all ways and means. They only saw the drone could able to control it and do it effectively without having interaction with the person or getting affected with the person. That led to a lot of a change. And subsequently, the health point of view, the medical delivery, vaccine delivery, which you see. So all these three things made what supposed to be done in 10 years is done in less than 6 months to 1 year. So earlier, if you're carrying a drone in a car or bring it to any hotel, they used to think you're carrying an AK-47 with you. To the change now, someone thinks it's very helpful, useful to the society, to the thing. That's a change we saw in almost in last 2 years. And to use a drone, like example, like you have a vehicle, you have a driving license, right? So that someone can tell you. So with the drones, if you have to just fly, every time you have to knock a police station and seek a permission for every day. Because in last 6 months or 1 year, what happened is they democratized the airspace. So till only the restricted areas, till airport, to the certain height restriction, majority area is in a green space where you don't need to seek any permission. If you're working in a research, you don't need to seek a permission. That's the change. And people like us who worked and had a lot of scientific data have given to the government. They're appreciating because of the employability factor. They've come out with 100%, 75% subsidy in agriculture space, but that leads to a more than like 3 to 5 lakh people employability in next 1-2 years because of the drones. That's all the ripple effect which we see is because I see a change in the state and central governments is they're listening to the industry and trying to accommodate, okay, let's do it. And let's figure it out. If something comes in the way, let's figure it out and let's do it. But let's make this happen is what I could see in the last 1-2 years.
Awesome. Abhijit, would love to hear from you.
Yeah. I feel that especially on the 5G or like the domain that we are working on, the regulation has been there, but for the coming last, I think 2 years, it has been very positive development. For example, I talked about private 5G, right? And also I talked in the last part that spectrums are heavily controlled by the government. Now, what has happened is that we had, over the last 1 year or 2 years, we were also requesting government that for any enterprises, let's say mining, oil and gas, or ports, they want to set up their own private 5G network. So they should be able to get the spectrum, because if it is to come only from the operators, then it will be difficult. I mean, and I think from the government, they have come up with a new regulation from TRI, which tells that any enterprises can directly go to DOT or WPC and actually ask for a spectrum. and it will be a localized spectrum. So it's a spectrum for only the mining area, spectrum only for the oil and gas area. So that, I think, is very transformational. And this has been happening in Germany, in US through CBRS. I mean, that's one band they are using, in Japan. So when you actually allow the enterprises to have the spectrum, they can use that spectrum to build their own network. You are not dependent on the operators for building the network. Because traditionally, if you see, right, when the private network or the Wi-Fi network is always built by the enterprise. They would have a connectivity to the internet which is public from the operator. But their internal network is always traditionally private because they would have operational data or IT data. Not everything they want to push in the cloud or to come to a public network. So it is a very transformational step taken by the government. And I think the auction of 5G has happened, I think, in August or September. And government has asked everybody to give their own ideas about this enterprise spectrum. I see by next year, we'll see a lot of companies doing their own private networks overall. So I think that has been transformational. The second thing, again, which I think is very positive, is like controlling some geographic or some nations and who would be allowed to develop private 5G telecom equipments in India, right? That regulation, I think, has also been useful because now there is a push, like in at least some places, that you should be using technologies which are developed in India, and you get some subsidies also for that. Especially, I mean, it may not be in the private sector, but probably in the PSU sector that may be useful because there are some subsidies given, or you can say that some discount would be given overall when you set up a solution using indigenous technology. And lastly, I think the government is also pushing to develop some new Huawei's or ZTEs out of India. So for that, it takes a long journey. I'll tell you, building something in networking or telecom is not 2 years journey. It's a 10, 15 years journey. So, but government is giving a lot of grants. I know of some companies who have got more than around 2 million grants from the government to build technology which can be used for building telecom connectivity solutions. So, and I mean, more than 50 companies are beneficiary of that. So that's, I think, is a great step because not everybody would be successful, but even if we get 1 or 2 Nokias or Ericssons or Huawei, that would be great, I think, building from India for the world. So
I think I'm sensing like a pattern here, which is, again, very encouraging. Whether it's the private spectral space and the grants being available, whether it's the fact that drone policy changed post-COVID. So it seems like policy is moving in sort of the right direction to finally enable innovation. So would love to get the last piece on medical diagnostic devices.
Sure. So again, COVID has done one thing good where India was one of the biggest manufacturer of vaccines, so which made people from other part of the country look at us very seriously in terms of medical devices and also vaccines and other biotech-related products and solutions. One thing that you would have also seen recently was a cough syrup that was distributed from India, which has led to death of more than 60 children in Africa. So it's extremely important in Indian geography and what a startup is developing in India to be following all the regulatory process. Of course, India has just started bringing in the new medical device rules and for drugs and other pharma products as well. But still, it is a little bit in the unclear geography. But the spirit that we need to take is we are not making the product only for India, but also for the world. And if we have to promote our product to US, where right now we are having a lot of interest from US, ASEAN countries, Singapore, Indonesia, even European markets, we need to follow the FDA, the EU MDR, the Singapore's HSA, and also right now the newly added is the Indian FDA, which is still in the gray area, but we are still navigating through. So it becomes very important for Indian companies to follow the regulatory process. But one key aspect is clinical trials is one of a very important segment when you're developing medical devices. And it's quite easy in India because of the population and the disease burden that we are presented with. So we can take that as the main motto, where what happens in US, which is a 2-year trial, in India it can finish within 6 months. So, and also you're not developing for one skin color, you're actually compensating for all the ethnicity, for this background skin noise that comes in, all the different biomarkers that are presented. For example, somebody in Rajasthan has a different kind of diabetic representation than someone in in Chennai or in the rural tribal villages. So this is what makes our solution unique, and this is exactly why we have put in AI. The AI decision was something that we did down the journey. We saw a lot of noise that's being represented in our clinical trial, and we wanted to compensate for it. So that's how we brought in AI to compensate for this background noise that is being presented, which decreases the accuracy. But now when I release this solution in US, it works perfectly. And US has come up with, again, very tighter norms in terms of data security, your data, how are you collecting the patient information. Even the AI you need to explain, saying how exactly is your AI predicting the particular disease. So all this is a new thing for any of the medical device person. And of course, DCGI in India has been more welcoming, where through BIRAC, which is the DBT's the non-profit and the grant wing, they do set up meetings every now and then if we have some queries that we have to post to the CDSCO or the DCGI. And I'm sure in the next 3 to 4 years, we will have clarity, and our regulatory norms will be in par with an Indian FDA or a CE marking. I hope it was not a long answer. But
Interesting to see COVID as yet another enabler of policy to push forward. Also, I completely agree on the point of clinical trials being, again, increasing in number and in scale in India, and sort of becoming more of a clinical trials hub. But continuing on the next question that I personally have from all of you, having been, a software engineer, I was very peaceful. I would very peacefully sit on my laptop, code, build, whatever I did was mostly software. So my life was very peaceful. So, would love to hear on the other side of, obviously you operate in or work very closely with hardware, whether it's, building drones, building the medical imaging devices, or being dependent on hardware to build your software solutions. So would love to hear, some articulation from all of you on, it's genuinely very difficult to build a hardware startup. It is so hard, no matter where you are. And it's even harder from India, just given the supply chains and things like that. So do you see any trends or any shifts now in terms of, building hardware startups out of India, or building products, in case of Niral, that are very closely tied to hardware? Has there any shift that has helped you? Sure.
Yeah. Definitely, it's very challenging. You do something from India that in hardware is because everybody thinks, China, you will get it now. Why you want to do it? But when it comes to the drone space, it's an aviation space where the regulatory body says it has to be an Indian citizen. It has to. There are a lot of restrictions that was the openness on drones was not there over the years. And what we saw was, if we wanted to take the existing products from the whatever is in China, Taiwan, or Singapore, or Israel, the problem what we were solving were not they were trying to understand. You see a DJI drone, which is a tiny drone, but our drones are heavy payload, like 25 kgs, 40 kgs, 50 kgs drones. If I say I want to do something for eradication of malaria, dengue, or if I say like for a afforestation or for the medical delivery, still they don't understand. Because when it comes to medical delivery, they think something you can deliver from point A to point B. But the problem of India is when you're sending a drone from a district hospital to a PHC doesn't have a fridge. So something you have to send from a district hospital, which is a temperature control, non-vibration, so that which is delivered in a PHC or community health center, which is given to a patient. That is very simple, because that when we talk to anybody which is in China or any other people, they think, so already someone is there, right? You just need to transport. But the problem with, like one more other is the tech. It's just not the hardware. Because hardware solves at 30-40% a problem, but more than 50% problem is solved through a software. Because all our autonomous drones, all our, like, the new guy can learn in less than 5 days or 6 days. That simple is what we could able to do it, because when we are building something in 2022, we can't do like what was built in 90s of a mobile phones, right? It has to be what mobile phones of today with the hardware and software. Something which we build is also similar in that lines. So the biggest the challenge what we saw was the lot of the use case are government-centric, right? Like the municipalities or for the health department. The B2B sector, like example, the agriculture sectors and everything, what they saw is the last technology they saw was a green revolution in 50 years back and everything. Till now, the digital transformation has never happened in agriculture. Thanks to a lot of agri-tech apps which are in digital claim a lot, but a farmer really have not seen a change with any of the technology which is there. So now when I'm bringing a specific hardware like a drone, which is disconnecting him from the access to this chemical which leads to a cancer. So to give you a very just type in Google cancer train. Every day train goes from Punjab to Rajasthan for treatment of a cancer. More than 80% of farmers who are going through the treatment for cancer. That's not just a problem of a Punjab or Rajasthan or thing. It's every state, every village, there is a post-45, post-50s, they're prone to a cancer because they have, over the years, all the traditional practice made them to access to that chemical, inhale the chemical. And with the drones, the biggest shift is a traditional farmer is spraying 100 liters per acre. With a drone, he sprays with 8 to 10 liters, and it doesn't have access at all. And like an example, crop like a chili, they spray 10 times in 120 days. And with the drones, now within 10 minutes, he's able to do which he was doing for 4 to 5 hours. So the hardware has become very critical, and to run this, software becomes more critical. Over the time, what happens is he can compare. Like to give a very simple, a farmer who does a spray 10th spray to first spray, he doesn't know what is the difference, whether he has actually covered entire crop. Now with the tech, what we have built, he can compare, he can see whether it has done entire crop, consistent, everything. So that's the difference. So to enable the certain particular problem or the impact, hardware is enabler, and to scale, the technology is helping us. So it's what we see is people see a hardware, physical, which is there. But the driving force or the entire, all this technology, like what Abhijit is doing, the 5G in the edge computing, going to be a big changer for us to when we adopt it. Is because real-time a farmer sees there's a pest, immediately he acts it. Presently what's happening is some imagery takes 2-3 days after they provide the more of farm advisory. By then the spread of disease has increased. That's why the farmer is still is not adopting the technology that faster what we think of. So the whole VC community, the investment community entire still thinks the hardware element is there and its regulatory space is there and everything, because we are going through a fundraise where we are trying to go through it. But there's a little change, is because non-government use cases are there, where the hardware is like a tractor, which is used for multi-purpose utility and can generate their ROIs within 3 months or 6 months. That's why where the hardware and software combination works for us.
Would love to get perspective from you as well, Geethanjali, building medical devices.
Sure. Right. So we chose hardware combined with software mainly because it has to solve a solution. Not every diagnostic problems can be solved just using a software. Of course, I'm not saying building a software company is hard, but building a hardware is 100 times harder, mainly because I would have done my regulatory certification. There's something called EMI, EMC safety testing. And then it goes out of production in the next 60 days. And then I have to do my EMI, EMC again because I'm changing a resistor or a capacitor once again. It may be the same product, maybe a similar one, but the part number has changed. And then there's a whole lot of supply chain disruption, and then I have to go build my inventory once again. And then it costs another 10 lakhs very easily. But what at the end of the day really motivates me through all this is, hardwares are the one that is going to actually disrupt the market. So the product that we have built, which is a handheld multispectral imaging device, We have put in our custom-made optics into it. The software can be used for any disease diagnostics. Of course, right now I'm using it for bacterial detection, but in future I can combine it with an endoscope for cancer detection. I can use it on food and agriculture in terms of understanding what is the quality of the produce. And I know how the architecture works, the hardware works. The data set that is built on this hardware, again, the data belongs to me. Nobody can replicate. Even if they replicate, the barrier to entry is longer. I have a patent for that. And this really motivates me because one hardware product has applications in all these different segments, and few things I haven't even named. So what essentially, after my 6 years of struggle, the true outcome is now I'm able to partner with somebody in a pharma company who can do water quality monitoring with my same device. All I have to do is give them the device, ask them to build the database, and then we train the AI to detect coliform bacteria in your mass manufacturing of the pharmaceutical product. Water is a very important component, and understanding the quality is important. Same way we are partnering somebody for cosmetology. You need to know how is your skin health. The same product can be used. So this is what really motivates me. It's hard, but it's innovative. It makes you stand out in the international space. And right now, we are even invited for a keynote speaker, which is a 45-minute talk from an International Society of Optics and Science. So that hardly any Indian companies get to do it. So what I started, without even knowing that it has a large-scale impact, has actually led to this. And this is exactly why people should be motivated to do something in hardware. Of course, AI and other software things are very important if you have to set yourself apart. I hope that really conveys and brings the spirit of starting hardware companies.
Yeah, I mean, one of the most successful companies would definitely also agree with you, called Apple, the small company that did hardware and software on building an end-to-end solution. But Abhijit, maybe let's get a slightly different perspective on you, because you don't directly have a hardware product. So we'd love to hear from you as well.
Yeah, our perspective or my thought is that, we have the application. I mean, we know of the revolution. At some point, Flipkart started. I mean, of course, first was Infosys and the services company starting the revolution of India being one of the hubs for software services. Then we had Flipkart in Bangalore. I mean, thankful to that. I mean, the startup revolution started in India. What I think in the next decade, like we talked about 3G, 4G, all Gs coming every 10 years, but the current G, I mean, or from the startup world, I think it's about building deep tech startups from 2020 to 2020, like 30 or 35. I think there'll be a lot of revolutions coming in the hardware, telecom, and foundational technologies out of India. I mean, the world has seen a lot of services, companies, a lot of apps, e-commerce companies coming out of India, but they are yet to see a really strong foundational technology company like maybe the hardware startup, telecom, coming out of India for the world. And that is going to happen in the coming 15 years. I'm very confident about that. And so the other thing is that we also think that slowly the ecosystem also has to support us, the startup. Because when you build a foundation technology, right, it takes a lot of grooming, around 5 to 10 years it takes. So if we have ecosystem partners, maybe who can do a POC, we're not talking about investment, but if who can do a really POC and then a paid POC, right, that would help. So we'll definitely urge companies or who can be our partners in this revolution. I mean, in drone or the deep tech, the telecom space, in everywhere, I think that would be key. I mean, we talk about only, like a lot of times we talk about investors, but it's not only about investors. I think we also want the enterprises, the PSUs to come together and really build some strong pilots which we can showcase. And from there, we really scale the product, I mean. So that is how I think really motivates me, and I'm really looking forward for the coming 10 years.
I mean, hearing all of this definitely motivates and excites me as an investor in a lot of the frontier and deep tech technologies. So super excited to watch out more on what happens in this space. I know this is more exciting than an India-Pakistan IPL match, and you would like us to go for longer, but we have to wrap up. We're already over time. So thank you so much for being a wonderful audience here. And of course, the panelists.
Please give our panelists a big round of applause. Once again, I'd like to request Manjot to please present a small token of our appreciation to our panelists.